Hey everyone, and welcome back to the Deep Dive. Today we're going deep into the world of cardiovascular health, specifically coronary artery disease, also known as CAD, and acute coronary syndrome.
Or ACS.
Right, ATS. You guys shared some nursing student materials with us, and honestly, some of this stuff is pretty fascinating, but also a little bit alarming.
Oh, definitely.
Like, get this, 9 out of 10 Canadians have at least one risk factor for heart disease.
It's a staggering statistic.
It is. It makes you think like, wait a minute, am I one of those 9? So today, we're going to break down what CAD and ACS actually are, how they differ, what those risk factors are, and what's new in terms of diagnosis and treatment.
Sounds like a plan.
All right, let's dive in. So to set the stage, can you give us a little refresher on the cardiovascular system? I remember from the nursing notes that it's helpful to understand the heart's basic functions.
Yeah, absolutely. It's all about the plumbing and the electrical.
Plumbing and electric. Okay, now you're speaking my language.
Think of your heart like a house. You need good plumbing to deliver water and a reliable electrical system to power everything up.
Makes sense.
In the heart, the plumbing refers to the blood vessels, the intricate network of arteries and veins that carry blood throughout your body. And the electrical system refers to the impulse conduction pathways.
So that's what makes sure the heart beats regularly.
Exactly. Those electrical signals trigger the heart muscle contractions, the pumping action that propels blood through those pipes we talked about.
So if either the plumbing or the electrical system is messed up,
Then things can go wrong pretty quickly.
which brings us to cardiac output, right? That's the amount of blood the heart pumps per minute.
Exactly. Cardiac output is essentially a measure of how efficiently your heart is delivering blood to the rest of your body. And if either that plumbing or the electrical system is compromised, it directly affects cardiac output.
And your overall health, right?
Exactly. And that's where conditions like coronary artery disease come into play.
Okay, so CAD, this is where the plumbing specifically in the coronary arteries gets affected.
You got it. These are the arteries that supply blood to the heart muscle itself, and when they become narrowed or blocked, the heart doesn't get the oxygen-rich blood it needs to function properly.
So what causes these crucial pathways to become compromised?
The main culprit is atherosclerosis.
Atherosclerosis.
Yeah, it's a buildup of plaque in the artery walls.
Like rust in a pipe.
Precisely. Over time, this plaque hardens and narrows the arteries, reducing blood flow to the heart muscle.
And this reduced blood flow is where things start to get dangerous, right?
Exactly. You can start experiencing symptoms like chest pain, known as angina, or in more serious cases, a heart attack.
Okay, so the more those arteries get clogged, the higher the risk of serious problems. But hold on a second. We said earlier that 9 out of 10 Canadians have at least one risk factor for CAD.
Right, that's right.
So are we all just walking time bombs?
Not necessarily. While some risk factors like age, sex, ethnicity, and family history are out of our control, there's a whole bunch of modifiable risk factors that we can actually do something about.
Okay, so what can we do to take charge of our heart health? Should we all be popping cholesterol-lowering pills and meditating on mountaintops? I'm kidding, but seriously, what can we do?
While medications definitely have their place, I'd say focusing on lifestyle changes is paramount.
Okay, like what? Spill the beans.
We're talking about things like managing cholesterol, blood pressure, and blood sugar levels, not smoking, eating a healthy diet, getting regular exercise, and managing stress.
Okay, that makes sense. But with that many Canadians having at least one risk factor, it feels like most of us are walking around with at least one thing working against our hearts. Are there any specific diet changes that can make a big difference?
Absolutely. Cutting back on saturated and trans fats is a good starting point.
Okay, so less greasy fast food and more what?
More lean meats, fruits, veggies, and whole grains.
Gotcha. So simple swaps can really add up. What about exercise? How much do we need to be moving to keep our hearts happy?
A good goal to aim for is at least 150 minutes of moderate to vigorous activity per week.
That sounds like a lot.
It doesn't have to be anything crazy, though. Even short bursts of activity throughout the day can add up.
So like taking the stairs instead of the elevator?
Exactly. Little things like that can make a difference.
Okay, so we're eating healthy, getting our steps in, saying no to cigarettes. What stands out to you as the most impactful lifestyle change people can make?
It's tough to pick just one because they all work together, but if I had to choose, I'd say quitting smoking. The damage smoking does to your blood vessels is no joke.
All right, so we're taking care of ourselves,
Yeah.
but what happens when those lifestyle changes aren't enough? Let's talk about angina, that chest pain you mentioned.
Angina pectoris.
Angina pectoris, right?
It's basically your heart crying out for help, signaling it's not getting enough oxygen-rich blood.
So how does that feel? What does it feel like?
It can vary from person to person, but usually feels like tightness, squeezing pressure, or heaviness in the chest, and it often radiates to the shoulders, arms, jaw, neck, or back.
So how can we tell if it's angina or just like heartburn or indigestion?
That's a great question. Angina typically lasts for a few minutes and subsides with rest or medication.
Okay.
It's also often triggered by physical exertion, emotional stress, or heavy meals.
Okay, so if I'm feeling that chest discomfort after shoveling snow, it could be angina.
Possibly. It's important to remember, though, that any undiagnosed chest pain is always considered cardiac until proven otherwise.
Wow, okay, that's a good reminder to never ignore chest pain. So, what steps are taken when someone comes in with chest pain? How is angina diagnosed and managed?
It starts with a thorough history and physical exam, including asking very specific questions about the pain, like its location, quality, duration, triggers, and what relieves it.
Right, getting all those details.
Exactly. Then we'll do an electrocardiogram, or ECG for short, to measure the heart's electrical activity.
ECGs, I've seen those in movies.
It can show abnormalities that point to ischemia,
Ischemia, that's
reduced blood flow to the heart muscle.
okay, so ECGs are like a window into the heart's electrical activity. So what happens if the ECG points towards angina? What are the next steps?
Well, depending on the results, additional tests might be needed. Things like blood work to check cholesterol levels, a Holter monitor for continuous heart rhythm tracking, or even an echocardiogram to visualize the heart's structure and function.
So many tests. It's amazing how much information we can get these days.
Technology has come a long way.
It really has.
Yeah.
Okay, so once angina is confirmed, what's next?
Managing angina often involves those lifestyle modifications we talked about earlier, along with medications to control symptoms and reduce risk.
Okay, so those healthy habits we discussed, plus some meds.
Right. There's a helpful acronym to remember the key components. A, B, C, D, E, F.
Ooh, I love a good acronym. Break it down for us. What does ABCDEF stand for?
It stands for antiplatelet or anticoagulation therapy, blood pressure control, cholesterol management, diet and diabetes management, exercise, and last but not least, education.
Education, that's an interesting one. What role does education play in managing angina?
Empowering patients to really understand their condition, what triggers their angina, and how to manage it is absolutely crucial. It's about giving them the knowledge to be active participants in their own care.
So it's not just about taking pills. It's about understanding what's going on and making informed choices.
Exactly.
Okay, I'm all about that. Now, I know there are different types of angina, and one sounds a lot more worrisome than the other. Can you explain the difference between stable and unstable angina?
Yeah, unstable angina is definitely more concerning. Stable angina is predictable, meaning you exert yourself, feel the chest pain, rest, and it goes away.
Okay, like if I go for a run and get chest pain, but it stops when I rest.
That's a classic example of stable angina. Now, unstable angina, on the other hand, is unpredictable.
Oh,
It's often more intense and doesn't respond to the usual measures.
that makes it sound like a much bigger red flag.
It is. Unstable angina can be a warning sign of a potential heart attack.
Okay, so that's a call 911 situation.
Absolutely. Any new onset chest pain or chest pain that feels different or worse than usual needs immediate medical attention.
Got it. No messing around with chest pain. But what about those medications you mentioned earlier? What are some common drugs used to manage angina?
One common class is antiplatelets.
Antiplatelets, those are like...
Aspirin and clopidogrel are examples.
Okay.
They work by preventing blood clots from forming and blocking the arteries further.
So it's about keeping those blood vessels clear?
Exactly. Now, for immediate relief of angina pain, we often use nitrates.
Nitrates.
Yeah, like nitroglycerin.
Isn't nitroglycerin used in dynamite?
It is.
Whoa, that's kind of scary.
Uh-huh. Well, in carefully measured doses, it can be a lifesaver for angina
Well,
patients.
I guess it's all about the dosage.
Exactly. Nitroglycerin works by relaxing and widening the blood vessels, allowing more blood to flow to the heart muscle.
It's like opening up those clogged pipes.
A perfect analogy.
What about other medications?
We also use beta blockers, like metoprolol or Adelol, to reduce the heart's workload and ease the strain.
So it's about giving the heart a bit of a break.
You got it. And then there are ACE inhibitors, which also relax blood vessels and lower blood pressure.
Wow. It's amazing how many different medications can be used to manage angina.
There are a lot of options available.
Okay, so we've covered angina pretty thoroughly, but what happens when those blockages become even more serious? Let's move on to acute coronary syndrome, or ACS.
ACS is a blanket term for conditions that occur when a coronary plaque ruptures, leading to clot formation that can potentially block blood flow to the heart.
Okay, so this is when things get really serious.
It can be very serious.
What are the different types of ACS?
We've already talked about unstable angina, which falls under the umbrella of ACS.
Right.
But there are also two types of heart attacks, STEMI and STEMI.
And STEMI. STEMI. Those sound like characters from Star Wars. What's the difference between them?
Essentially, the key difference is in the severity and type of blockage. STEMI stands for non-ST elevation myocardial infarction, and it involves a partial blockage of a coronary artery. Blood flow is significantly reduced, causing damage to the heart muscle, but it's not completely blocked.
So damage is being done, but it's not fully blocked.
Right, exactly. Now, STEMI, or ST elevation myocardial infarction, that's the most severe type. It involves a complete blockage of a coronary artery.
So that's the classic heart attack we see in movies, someone clutching their chest.
Yeah, pretty much. And with STEMI, time is of the essence. The longer that blockage remains, the more heart muscle is damaged.
Okay, this is all starting to sound pretty scary. How can we recognize the signs of a heart attack, especially considering some people experience those less obvious symptoms you mentioned earlier?
The classic symptoms include persistent chest pain, often described as crushing or squeezing, lasting more than a few minutes, not relieved by rest or nitroglycerin.
Okay, so that's a big red flag.
Definitely. But it's crucial to be aware of the less common signs as well, especially in women.
So things like fatigue, shortness of breath, indigestion, or just a general feeling of discomfort.
Exactly. It's essential for both healthcare providers and individuals to be aware of these atypical symptoms and to never dismiss chest discomfort without proper investigation.
It sounds like a thorough assessment is key to catching these issues early. What specific questions would a nurse ask of someone experiencing chest discomfort?
We'd want to know the precise location of the pain, its quality, how long it lasts, what triggers it, and what relieves it, if anything.
So really getting a detailed picture of the pain.
Yes, and we also ask about any associated symptoms, such as sweating, nausea, or shortness of breath.
It sounds like nurses play a crucial role in swiftly recognizing and responding to a potential heart attack. What happens once a heart attack is confirmed?
Rapid response is key.
Every minute counts, right?
Absolutely. The goal is to restore blood flow to the heart muscle as quickly as possible.
So what are those immediate steps taken in a hospital setting?
First, we assess the patient, get them on a 12-lead ECG, administer oxygen to maintain good blood oxygen saturation, and establish IV access.
Okay, so stabilizing the patient.
Right. Then we'll administer medications like aspirin to prevent further clotting and nitroglycerin to relieve chest pain and widen those blood vessels.
And I imagine morphine might be used for pain management.
You're right. Morphine not only helps alleviate pain, but also reduces anxiety, which is important because anxiety can actually worsen cardiac symptoms.
Makes sense. You don't want to add fuel to the fire.
Exactly.
So the patient is stabilized, medications are administered, and the ECG confirms a heart attack. What's next?
The next steps depend on the type of heart attack.
Okay, so STEMI versus STEMI.
Exactly. For STEMI, the gold standard treatment is a percutaneous coronary intervention, or PCI.
PCI, no, that sounds complicated.
It's more commonly known as angioplasty with stenting.
Angioplasty, that's the one where they use a balloon.
You got it. Imagine a tiny balloon threaded through a catheter up to the blockage in the coronary artery. The balloon is inflated, pushing the plaque against the artery walls and restoring blood flow.
So it's like unclogging a drain pipe, but in your heart.
Exactly.
Wow, that's amazing. And what about stents? Where do they fit in?
Stents are tiny, expandable metal mesh tubes.
Okay.
They're often inserted during angioplasty to help prop open the artery and prevent it from collapsing or re-narrowing.
So they're like tiny scaffolding for the arteries.
Precisely.
Clever. But are there any risks associated with angioplasty?
While it's generally safe, like any procedure, there are potential risks such as bleeding, infection, or damage to the artery.
But it's not a risk-free procedure, but it can be life-saving.
Exactly. In a heart attack situation, the benefits often outweigh the risks.
Okay, that makes sense. What about STEMI? Is it treated the same way?
Not always. With STEMI, the decision for angioplasty depends on the severity of the blockage and the patient's overall health. Sometimes medications alone may be enough to stabilize the patient and allow the body to heal.
So a more conservative approach might be taken in some cases. What other treatment options are available for heart attacks if angioplasty isn't suitable or hasn't been successful?
If angioplasty isn't feasible, fibrinolytic therapy using clot-busting medications might be an option.
Clot-busting medications so they actually dissolve the blockage.
Exactly. However, these medications do carry a higher bleeding risk, so they're not suitable for every patient.
So fibrinolytics are kind of a backup plan when angioplasty isn't an option.
That's a good way to think about it.
What about surgery? Is that ever used for heart attacks?
Absolutely. Coronary artery bypass graft surgery, or CABG, is another
You
option.
said ABG, that's open heart surgery, right?
Yes, it is. It's a major procedure where healthy blood vessels are taken from other parts of your body, like your leg or chest, and used to create detours around the blocked arteries.
Wow, so they're literally bypassing the blockage.
Exactly. It's like building new roads for the blood to travel on.
That's incredible.
Yeah.
But I imagine recovery from open heart surgery is pretty challenging.
It definitely requires significant recovery time and rehabilitation.
What does that involve?
Patients need to gradually increase their activity levels, adhere to their medication regimens, and attend cardiac rehab to help them regain strength and function.
So it's a long road back.
It can be, but with the right support and dedication, most people can make a good recovery.
That's good to hear. Before we move on to the next part of our deep dive, I'm curious about something. In the nursing notes, they mention this idea that our bodies can actually build their own natural bypasses around blockages. Is that true? Can you explain more about that?
You're talking about collateral circulation.
Collateral circulation, okay.
It's pretty remarkable, actually. Over time, if blood flow through a coronary artery is slowly reduced, smaller alternative blood vessels can develop to help bypass the blockage.
So it's like our body's rerouting the blood supply, creating detours around a traffic jam. That's incredible. Does this happen in everyone?
While collateral circulation can occur naturally, it's more likely to develop in people who maintain a healthy lifestyle.
So those healthy habits we talked about earlier can actually help our bodies heal themselves.
Exactly. Regular exercise in particular seems to play a key role.
So by making those healthy choices, we're not just preventing further damage, we're actually giving our bodies a better chance to heal themselves. That's a powerful motivator.
It really is. It highlights the incredible resilience of the human body.
I completely agree. Welcome back to the deep dive. Now, I know we talked about the different treatment options for heart attacks, including that intense CABG surgery.
Coronary artery bypass graft surgery.
Right, CABG. What's the recovery process like for someone who's undergone that procedure?
It's definitely a challenging journey. Immediately after surgery, patients are closely monitored in the intensive care unit, or ICU.
Makes sense, it's a big surgery. So what are the main concerns after CABG?
We're watching for things like bleeding, infection, arrhythmias, and fluid buildup.
Okay, those complications definitely sound serious. Can you walk us through some of the specifics? What exactly are nurses looking for when monitoring for these potential problems?
Sure. For bleeding, we're checking the surgical site and any chest tubes that might have been placed to drain fluid.
Chest tubes, what are those for?
They're inserted during surgery to drain any blood or fluid that might accumulate around the heart and lungs.
Okay, so they're like drains.
Exactly. We want to make sure the drainage isn't excessive or bloody. Infection is another big concern. So we're monitoring for things like fever, redness, swelling, or drainage from the incision.
So it's all about preventing those post-op infections. What about the heart itself? Are there specific things you're looking for to make sure it's functioning properly after surgery?
Absolutely. We're continuously monitoring the patient's heart rhythm for any irregularities.
Looking for those arrhythmias we talked about earlier.
Exactly. Dysrhythmias, or abnormal heart rhythms, are common after CABG surgery because of the trauma the heart has undergone.
So they're hooked up to a heart monitor, watching for any signs of trouble.
Yes, exactly. What about fluid buildup? You mentioned pleural effusions and cardiac tamponade earlier. Can you explain those a bit more?
Yeah, those sound a bit scary.
They can be. A pleural effusion is when fluid builds up in the space between the lungs and the chest wall, making it harder to breathe.
Okay, so fluid in the lungs, that doesn't sound good. And what about cardiac tamponade?
Cardiac tamponade is much more serious. It's when fluid builds up in the sac surrounding the heart, putting pressure on it and preventing it from pumping effectively.
So it's like the heart is being squeezed. That sounds really dangerous.
It is. It can be life-threatening if not treated quickly.
How do nurses detect these conditions? How do you know if there's fluid building up?
We use a combination of techniques, including listening to the lungs, monitoring heart rate and blood pressure, and observing for any signs of shortness of breath or chest discomfort.
So it's about being very observant and catching those subtle signs early on. What about things like swelling or circulation problems?
We keep a close eye on those too. Swelling in the legs and feet, called peripheral edema, can happen after CABG. It's often due to fluid shifts or decreased mobility. We also check for any signs of decreased blood flow, like pale or cool extremities.
So it's not just about the heart, it's about the whole body, right? It seems like nurses are playing detective, looking for any clues that something might be wrong.
That's a great way to put it. We're constantly assessing, monitoring, and intervening to ensure the best possible outcome for our patients.
It's a huge responsibility.
Yeah.
But recovery isn't just about the physical aspects, right? There's a huge emotional component to consider as well.
Absolutely. Having a heart attack or undergoing major surgery like CABG is a life-altering event. Patients often feel anxious, scared, and sometimes even depressed after these experiences.
I can only imagine. It's a huge psychological adjustment. How can healthcare providers help patients cope with that emotional fallout?
One of the most important things we do is simply listen. We create a supportive and empathetic environment where patients feel comfortable expressing their feelings.
So it's about acknowledging those emotions and letting patients know they're not alone in this journey.
Exactly. We want them to feel heard and understood. We answer their questions honestly and provide reassurance without minimizing their concerns.
Right, it's about validating their experience. What about patient education? What are some key things patients need to know as they prepare to go home after a cardiac event or surgery?
We want to empower patients to be active participants in their recovery. So we teach them about their medications, potential side effects, and the importance of following their prescribed regimen.
So it's like a crash course in heart health management.
You could say that.
Yeah.
We talk about the importance of lifestyle changes like adopting a heart-healthy diet, quitting smoking if they haven't already, getting regular exercise, and finding healthy ways to manage stress. And we emphasize the importance of recognizing warning signs and knowing when to seek immediate medical attention.
So it's about equipping them with the knowledge and tools to live a healthier life once they leave the hospital. What about cardiac rehabilitation? I know you mentioned it earlier, but can you explain more about what it involves?
Cardiac rehab is a medically supervised program that combines exercise education and counseling to help patients regain strength, improve their cardiovascular health, and reduce their risk of future cardiac events.
It sounds like a really comprehensive program. Who typically gets referred to cardiac rehab?
Most patients who've had a heart attack, undergone angioplasty or stenting, or had CABG surgery are good candidates for cardiac rehab. It's tailored to each individual's needs and can be really valuable.
So it's like a personalized plan to help people get back on their feet.
Exactly.
This has been such an insightful look at the recovery process after a cardiac event. I'm really starting to appreciate how important it is to address both the physical and emotional aspects of healing.
It's all interconnected. We can't just focus on the physical without considering the emotional and vice versa.
Well said. Now, I know we touched on the heart's electrical system earlier, comparing it to the wiring in a house. Can we delve a little deeper into that? I'm fascinated by this intricate system that keeps our hearts beating in sync.
It is fascinating, isn't it? Think of your heart as an orchestra.
Okay, I like where this is going.
Each section playing its part in perfect harmony to create a beautiful symphony.
And the conductor of this orchestra is?
The sinoatrial node, or SA node, which is located in the right atrium.
So the SA node sets the tempo for the whole heartbeat.
Exactly. It generates electrical impulses that spread through the atria, causing them to contract and pump blood into the ventricles.
Okay, so that's the first beat. What happens next?
The electrical impulse then travels to the atrioventricular node, or AV node for short, which acts like a gatekeeper, slowing down the impulse before it's passed on to the ventricles.
Why is that pause important?
That slight delay gives the ventricles time to fill with blood before they contract. It's all about timing and coordination. Without that pause, the ventricles wouldn't be able to pump effectively.
So the AV node ensures the ventricles are fully loaded before they send that blood out to the body. What happens after the AV node? Where does the electrical signal go from there?
From the AV node, the impulse travels down a pathway called the bundle of His, which then splits into right and left bundle branches, carrying the impulse to the respective ventricles.
So the signal branches out, making sure both ventricles get the message.
Exactly. And finally, the impulse reaches the Purkinje fibers, which spread throughout the ventricular muscle, triggering a synchronized contraction that pumps blood out to the body.
Wow, it's like a perfectly choreographed dance of electrical impulses. It makes you appreciate the complexity of this system. But what happens when this system gets disrupted? That's when we get those arrhythmias you mentioned, right?
Exactly. Arrhythmias can occur when there's a problem with the generation or conduction of those electrical impulses. It could be the SA node firing too fast or too slow, a blockage in the conduction pathways, or even rogue cells in the heart muscle generating their own abnormal impulses.
So it's like a glitch in the matrix throwing off the rhythm of the heartbeat. What kind of problems can those arrhythmias cause?
It really depends on the type of arrhythmia. Some are harmless and don't cause any noticeable symptoms. Others can cause palpitations, dizziness, fainting, or even more serious problems if the heart can't pump blood effectively.
That's where it starts to sound more concerning. How are arrhythmias diagnosed?
The electrocardiogram, or ECG, is our go-to tool for diagnosing arrhythmias. It provides a visual representation of the heart's electrical activity, allowing us to see those abnormal patterns and pinpoint the type of arrhythmia.
So the ECG is like a detective's magnifying glass, revealing those hidden electrical glitches. How are arrhythmias treated?
The treatment depends on the type and severity of the arrhythmia. Some, as I mentioned, require no treatment at all. Others might be managed with lifestyle changes, medications, or in some cases, procedures.
What kind of procedures are we talking about?
One option is cardioversion, which involves delivering a controlled electrical shock to the heart to reset its rhythm.
It's like hitting the reset button on the heart's electrical system.
That's a good analogy. Another option is catheter ablation, where a thin, flexible tube is inserted into the heart to destroy the abnormal tissue causing the arrhythmia.
So it's like a targeted strike eliminating the source of those rogue electrical impulses.
What about pacemakers? I've heard those are used to treat certain types of arrhythmias. Pacemakers are small implantable devices that help regulate the heart's rhythm. They're used for people with slow heart rates or heart block where the electrical signals aren't getting through properly. It's essentially like having a backup conductor for the heart.
That makes sense. So a pacemaker steps in when the heart's natural pacemaker isn't working properly. Are there other devices used for arrhythmias?
Yes. For people with life-threatening arrhythmias, an implantable cardioverter defibrillator, or ICD, might be recommended.
An ICD, what's that?
It's similar to a pacemaker, but it also has the ability to deliver shocks to the heart if it detects a life-threatening arrhythmia.
So it's like a more advanced pacemaker that can also intervene in an emergency.
Exactly. It acts as an internal defibrillator ready to step in if needed.
Wow, that's incredible how technology can step in to support the heart's function.
Yeah.
We've talked about ECGs and these implantable devices, but what about blood tests? What role do they play in diagnosing and managing heart conditions?
Blood tests offer a wealth of information about cardiovascular health. One of the key tests we use is for cardiac biomarkers like troponin.
Right. Troponin, those are the proteins released into the bloodstream when the heart muscle is damaged, right? It's like a smoke detector, alerting us to damage even if we can't see the fire itself.
That's an excellent analogy. Elevated troponin levels are a strong indicator of a heart attack, even if the ECG doesn't show classic ST segment elevation.
So it's a valuable tool for diagnosis. What other blood tests are commonly used in cardiology?
We also check lipid profiles to measure cholesterol levels. High cholesterol is a major risk factor for coronary artery disease, so monitoring those levels is essential.
Okay, cholesterol checkups are a must. And I imagine blood sugar levels are important to monitor as well, especially considering the link between diabetes and heart disease.
You're absolutely right. Diabetes is a significant risk factor for heart disease, so monitoring blood sugar levels is essential. We also check kidney function, as the kidneys and heart are closely linked.
This is really highlighting how interconnected our bodies are. Everything seems to affect everything else.
It truly does, and that's why taking a holistic approach to health is so important. We can't just look at the heart in isolation. We need to consider all these interconnecting factors.
Speaking of holistic approaches,
Yeah.
we talked briefly about diet earlier, but I'd love to delve deeper into what a heart-healthy diet actually looks like. What are the building blocks for a strong and resilient cardiovascular system?
A heart-healthy diet is all about making choices that nourish your heart and blood vessels. It's not about deprivation or extreme restrictions. It's about making sustainable changes that support your overall health.
Okay, I'm ready to build a heart-healthy plate. Where do we start?
The foundation of any healthy diet is fruits and vegetables. They're packed with vitamins, minerals, and antioxidants that protect your heart. Aim for at least 5 servings a day.
5 servings, that sounds like a lot.
It might seem like a lot, but it's easier than you think. Incorporate them into every meal and snack. Have fruit with your breakfast, a salad with lunch, and veggies with dinner.
Good tips. What else should we be loading up on?
Whole grains are another key component. They provide fiber, which helps lower cholesterol and regulate blood sugar. Choose whole grain bread, pasta, and rice over their refined counterparts.
Got it. So brown rice over white rice, whole wheat bread over white bread. What about protein? Any specific recommendations there?
When choosing protein sources, opt for lean options like fish, skinless poultry, beans, lentils, and tofu. Fish, particularly oily fish like salmon, tuna, and mackerel, are rich in omega-3 fatty acids, which are particularly beneficial for heart health.
Omega-3s, good for the brain and the heart. Got it. What about dairy products?
Choose low-fat or fat-free dairy products. They provide calcium and vitamin D without the added saturated fat found in full-fat versions.
All right, so low-fat dairy it is. What about fats in general? Are all fats bad for the heart?
Not at all. It's important to distinguish between different types of fats. Saturated and trans fats, which are found in many processed foods and fried foods, are the ones that increase bad cholesterol and boost the risk of heart disease.
So we want to limit those unhealthy fats. What about healthy fats? Are there any fats that are actually good for us?
Yes. Monounsaturated and polyunsaturated fats found in foods like olive oil, avocados, nuts, and seeds are actually beneficial for heart health. They can help lower bad cholesterol and improve overall cardiovascular function.
So it's about making smart choices and swapping out those unhealthy fats for heart-healthy ones.
Exactly. And moderation is key. You don't have to completely eliminate all your favorite foods, but it's about finding a balance and choosing heart-healthy options whenever possible.
That's good advice for life in general. Are there any other dietary considerations we should be thinking about in terms of heart health?
One thing that often gets overlooked is sodium intake. Too much sodium can raise blood pressure, putting extra strain on your heart. Limiting processed foods, fast food, and restaurant meals, which tend to be high in sodium, is a good way to keep your intake in check.
So cooking at home more often gives you more control over the ingredients and sodium levels.
Yeah.
What about alcohol? Is a glass of wine with dinner okay for heart health?
Moderate alcohol consumption might offer some heart benefits, but excessive intake can damage the heart and increase the risk of other health problems. If you choose to drink alcohol, do so in moderation and talk to your doctor about what's appropriate for you.
Moderation is key, once again. What about portion control? Does that play a role in heart health?
Absolutely. Even healthy foods can contribute to weight gain if you eat too much of them. Pay attention to portion sizes and listen to your body's cues of hunger and fullness.
It's about being mindful of what and how much we're eating. This is all great advice. I'm starting to see how food can truly be medicine for the heart. But diet is just one piece of the puzzle, right? We've got exercise, stress management, and not smoking to consider as well.
You're absolutely right. It's about taking a holistic approach to heart health and incorporating all these lifestyle factors.
Let's break those down one by one. First up, exercise. What are the key recommendations for physical activity? How much should we be aiming for?
A good goal is to aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week.
And that could be spread out throughout the week, right?
Exactly. It doesn't have to be all at once. You can break it up into smaller chunks throughout the week.
So brisk walking, cycling, swimming, dancing, anything that gets the heart rate up.
Exactly. And remember, it doesn't have to be all at once. Even short bursts of activity throughout the day can add up and make a difference.
So taking the stairs instead of the elevator, parking farther away from the store, even just getting up and moving around every hour or so can contribute to a healthier heart.
You got it. It's about making movement a part of your daily routine.
Okay, I'm feeling motivated to get moving. What about stress management? How does stress impact the heart? I know when I'm stressed, my heart definitely beats faster.
Chronic stress can trigger the release of hormones that increase heart rate and blood pressure, putting extra strain on the heart. Over time, this can contribute to the development of heart disease.
So finding healthy ways to manage stress is essential for heart health. What are some effective stress-busting techniques?
There are countless ways to manage stress. The key is to find what works best for you and incorporate it into your daily life. Exercise is a fantastic stress reliever. Meditation, yoga, deep breathing exercises, spending time in nature, listening to music, and connecting with loved ones can all help reduce stress levels.
It's about finding those outlets that help you unwind and recharge. And finally, let's talk about smoking. We all know it's bad for us, but how does it specifically damage the heart?
Smoking damages the lining of blood vessels, increases blood pressure, and reduces the amount of oxygen that reaches the heart. It's one of the most significant risk factors for heart disease, plain and simple.
So quitting smoking is one of the best things you can do for your heart.
Absolutely. And there's support available if you need help quitting. Talk to your doctor about options like nicotine replacement therapy, medications, or support groups.
It's never too late to quit and reap the benefits for your heart health. This has been an incredibly comprehensive look at lifestyle factors and their impact on the heart. I'm starting to see how all these pieces fit together to create a truly heart-healthy lifestyle.
That's exactly the point. It's about making those conscious choices step by step to create a healthier future for yourself.
But even with the best lifestyle choices, sometimes things happen and medical interventions are needed. We've talked about some of the more common procedures used to treat heart conditions, but I'm curious about some of the newer cutting-edge advancements in cardiology. What's on the horizon?
That's a great question. The field of cardiology is constantly evolving, with new technologies and treatments emerging all the time. One exciting area is minimally invasive surgery.
Minimally invasive surgery, that sounds promising. How does it differ from traditional open heart surgery?
Minimally invasive techniques allow surgeons to access the heart through smaller incisions, which means less pain, quicker recovery times, and fewer complications for the patient.
So it's a gentler approach, but still achieving the same goals. What are some examples of minimally invasive heart procedures?
One example is transcatheter aortic valve replacement, or TAVR. It's a procedure used to replace a narrowed aortic valve without open heart surgery.
Wow, that's incredible. How's that even work?
A new valve is delivered to the heart through a catheter inserted into a blood vessel in the groin or chest. The new valve is then expanded into place, pushing the old narrowed valve aside.
So it's like a valve and a catheter delivered right to the source. What other minimally invasive techniques are being used?
Another example is mitral valve repair, using a clip device. This procedure is used to repair a leaky mitral valve without open heart surgery. A small clip is attached to the leaflets of the mitral valve, reducing the leakage and improving blood flow.
It's amazing to think these procedures can be done without open heart surgery. What about robotic-assisted surgery? Is that being used in cardiology?
It is. Robotic-assisted surgery is another exciting area of innovation. It allows surgeons to perform minimally invasive heart procedures with even greater precision and control.
So it's like having a super steady hand, minimizing the risk of human error.
Exactly. And it allows for surgery in tighter spaces, making it possible to perform even more complex procedures minimally invasively.
It sounds like the future of heart surgery is heading towards less invasive procedures, which is great news for patients. What about advancements beyond surgery? Are there new ways to diagnose and monitor heart conditions non-invasively?
Absolutely. Imaging techniques are becoming increasingly sophisticated, providing us with incredibly detailed images of the heart. For example, cardiac CT scans and cardiac MRI now offer high-definition roadmaps of the heart's structure and function.
That's incredible. So we can detect problems earlier and make more informed treatment decisions. What about new medications? Anything promising on the horizon?
There is always research underway. One area showing great promise is the development of PCSK9 inhibitors, a new class of cholesterol-lowering drugs.
I've heard of PCSK9 inhibitors. How do they work?
They're antibodies that target a protein called PCSK9, which plays a role in regulating cholesterol levels in the blood. By blocking PCSK9, these drugs help lower bad cholesterol levels even further than traditional statins.
So it's like they're taking statins to the next level.
Yeah, exactly. And they're showing great potential in reducing the risk of heart attacks and strokes.
It sounds like we're on the cusp of a new era in cardiovascular care with less invasive procedures, more precise diagnostics, and even more effective medications. It's a really exciting time for the field.
It really is. And it's not just about these groundbreaking technologies and medications. It's also about empowering individuals to take control of their own heart health.
I completely agree. We've talked about so many actionable steps people can take to reduce their risk and live a heart-healthy life. What do you think is the most important takeaway for our listeners?
I'd say the most important message is that you have more power over your heart health than you may realize. Every small, positive change you make, from eating more fruits and vegetables to managing stress, can make a real difference. It's never too late to start taking care of your heart.
That's such an important message. We're not just passive bystanders. We can actively shape our heart health destinies. This has been such an incredible deep dive into the world of cardiovascular health. Thank you so much for sharing your expertise with us today.
It's been my pleasure. Thanks for having me.
And to all our listeners, thank you for joining us on this deep dive. We hope you've learned something valuable today. Remember, your heart health matters. Take care of it, and it will take care of you. Until next time, stay curious, stay informed, and most importantly, stay heart healthy. Welcome back to the Deep Dive. You know, we've covered so much ground in this deep dive, from the nitty-gritty of how the heart works to all the amazing advancements and treatments.
It's been quite a journey.
It has. But something that keeps coming back to me, and it's so important, is the emotional and psychological impact of heart conditions.
Absolutely. You're right, it's something we can't overlook.
It's easy to get caught up in the science, the procedures, the medications, but at the end of the day, it's people going through these experiences.
You're absolutely right. A cardiac event, whether it's a heart attack, angina, or even just a diagnosis of heart disease, can be incredibly stressful.
Right. It can turn your whole world upside down.
It can, and it often brings up a lot of difficult emotions, not just for the individual, but also for their families.
So what are some of those common emotional responses people might experience after a cardiac event? What comes up for people?
Well, fear and anxiety are very common, I think.
That makes sense, right?
People often worry about having another heart attack,
The big one.
or dying, or becoming a burden to their loved ones.
So much uncertainty.
There really is. It's a lot to process.
Are there other emotions that come up besides fear and anxiety?
Oh, definitely. Some people experience denial or disbelief.
Really?
Yeah, they might downplay their symptoms or resist making those lifestyle changes, even though they know it's important.
It's like they're trying to protect themselves.
It could be a coping mechanism. And anger is another natural response.
Anger. At what or at whom?
Well, it's understandable to feel angry at your body for sort of betraying you, or even angry at yourself for not taking better care of your health in the past.
It sounds like such a roller coaster of emotions.
It is. It really is. And I think it's important to remember that there's no right or wrong way to feel.
Everyone processes things differently.
Exactly. Everyone processes these experiences in their own way, at their own pace. The important thing is to acknowledge those feelings, not try to bottle them up.
Let it out, talk about it.
Exactly.
Yeah.
Talking about it can make a world of difference.
Okay, so how can we support people emotionally? What can healthcare providers do? What can friends and family do to help?
The most important thing is to listen. Just listen. Create a safe and non-judgmental space for people to express those fears, anxieties, frustrations.
Make them feel heard?
Exactly. Without feeling dismissed or judged,
Because there's nothing worse than feeling like your feelings aren't valid.
Exactly. You want to validate their experience. Let them know it's okay to not be okay.
We all have those moments.
We do. And education is key as well. When patients understand their condition, the treatment options, what to expect during recovery, it can really help alleviate some of that anxiety about the unknown.
Take away the mystery and some of the fear.
Precisely. And never underestimate the power of empathy and reassurance. Let them know you understand what they're going through, that you're there for them.
That human connection can be so powerful. It's about reminding them they're not alone in this. What about resources outside of the healthcare setting? Are there support groups or organizations that can help?
Absolutely. Cardiac rehabilitation programs often include a psychological component, providing counseling and support groups for both patients and their families.
That's great. So it's not just about the physical recovery.
Right. And there are great organizations like the Heart and Stroke Foundation that offer a wealth of resources and support.
It's amazing to see how much support is out there. It really takes a village, doesn't it?
It does. It
Yeah.
really does. It's not just about the healthcare team. It's about the whole support system rallying around the person.
We've covered so much ground today in this deep dive, it's mind-blowing. We started with the intricate workings of the heart, then delved into all these incredible treatment options and how to recover, and now we're talking about the emotional and psychological well-being of people living with heart conditions.
It's all interconnected, isn't it?
It really highlights that heart health is about so much more than just the physical aspects.
It is. It truly is. It's about caring for the whole person, mind, body, spirit.
Well said. Before we wrap up, I want to circle back to something you said earlier about empowering individuals to take control of their own heart health, to be proactive. What are those practical steps people can take to reduce their risk and live a heart-healthy life? What can they do starting today?
Well, it starts with awareness, right?
Knowing your numbers.
Exactly. Understand your risk factors, both the ones you can and can't control.
Right, because some things we can't change.
Exactly. But we can focus on what we can control. Get those regular checkups, know your blood pressure and cholesterol numbers, and don't hesitate to talk to your doctor about any concerns you have.
Being your own advocate.
Absolutely. And then it's about putting that knowledge into action. Make those lifestyle changes we've been discussing. Eat a heart-healthy diet, get regular exercise, manage stress, and if you smoke, quit.
It sounds simple enough, but I imagine it can be quite challenging to actually make those changes stick.
It can be. But remember, progress, not perfection, is the goal. You don't have to do everything at once. Start with one small change, make it a habit, and then add another.
One step at a time.
Exactly. And don't be afraid to ask for support. Talk to your doctor, join a support group, find a workout buddy, or share your goals with a friend or family member.
It's about building that support system, finding those people who will cheer you on.
Exactly. You don't have to do it alone.
This has been such an eye-opening deep dive. I feel like I've learned so much, not just about the heart itself, but also about the power we have to take care of it.
I'm so glad to hear that. And remember, knowledge is power. When it comes to heart health, you have the power to make a real difference.
Well said.
Yeah.
A huge thank you to you for joining us and sharing your expertise.
My pleasure. Thanks for having me.
And to all our listeners, thank you for joining us on this incredible journey into the world of heart health. We hope you've learned something valuable today. Remember, your heart health matters. Take care of it, and it will take care of you. Until next time, stay curious, stay informed, and most importantly, stay heart healthy.